From ground zero to the global picture, while the world focuses on how China is containing the virus, it is worth considering what could happen if this epidemic spreads. Are governments across the world prepared for such an outbreak? So far, isolated cases have been reported, but many say that the worst is yet to come.
This is not undue panic. The Wuhan virus is spreading and the worst isn't over. This is what the world map looks like. What started from one food market has plunged the entire world into chaos. The virus has sickened over 7,000 people in at least 20 countries. "14 cases have been detected in Thailand, the most in any country outside China. 158 people, mostly foreigners, have been placed in quarantine. The spread of the virus and China's ban on group tours has hit Thailand's tourism industry. China is Thailand's biggest source of visitors. It accounted for 28% of 40 million arrivals last year. Now the country is bracing for losses worth 1.5 billion in tourism revenue. In Japan, 11 cases of coronavirus have been reported. 3 out of the patients are evacuees from Wuhan. The bigger worry, Tokyo will be hosting the Summer Olympics in a matter of months and coronavirus vaccines are still not ready. The country's Prime Minister says that prevention of the virus before July is Japan's top priority.
From now on, we need to carefully consider the characteristics of the virus. We need to prevent the virus spreading. We will take flexible and swift measures without being bound by previous ideas, while closely watching the situation.
Not far away in Hong Kong, surgical stores are running out of face masks amid increasing cases. 10 people have been infected so far. Taiwan has reported its 9th case of coronavirus. The anxiety has led to domestic markets tumbling by 6%.
I have instructed relevant departments to take some measures in response, the first of which is to stabilize the stock in foreign exchange markets and to reduce the shocks from short-term psychological factors.
A dozen other nations are isolating patients and monitoring their contacts. Travelers are being screened, but virus is not stopping at passport counters. Today, health officials in Philippines confirmed the first case of the virus, a 38-year-old Chinese man who arrived to the country from Wuhan.
The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. The patient sought consult and was admitted in one of the country's government hospitals last January 25 after experiencing mild cough.
It's the same story in Sri Lanka as well. A Chinese tourist who arrived to the country on 21st January has been tested positive. The country has ended its policy of visa on arrival for Chinese nationals. Russia has gone far ahead and sealed its long border with China. In South Korea, citizens volleyed eggs and imperatives on officials over plans to quarantine hundreds of citizens. In Italy, 6,000 people were kept on board an Italian cruise ship as tests were conducted on 2 Chinese passengers. The virus hasn't reached its peak yet. There is no specific cure or vaccine. The world must be ready for a long fight. Bureau Report, WION World is One.